Hi. Okay, so I wanted to go over some things with Sarah coming back to the day program. She did have a second period of psychosis that was significantly more challenging and crisis related. She required multiple days in an inpatient setting, and her mental health and functioning really deteriorated to a very difficult and scary place. And she has, since last Thursday, begun to progress out of that, and appears to be ready to come back to a typical schedule. And hopefully that's even going to help her more. But we do really all want to be aware of that she is in a very mentally fragile place, and has some changes in behavior that we want to, one, be tolerant of, and two, just help her with. So we really want to remember that really pushing Sarah could be really detrimental to her progress out of this psychosis right now. And also, as caregivers, reminding ourselves that none of these behaviors are intentional or related to specifically behavior. They are related to her level of mental health. So even though they may require some extra patience on our part, it is really important to remember that this is how she is making the world okay for herself right now. Her mental health really got to a place where the world definitely did not feel okay for her. And so there are some self-coping skills that we want to remember are just related to her mental health. So a lot of things that appear related in an OCD type of way, rituals, have really intensified. So Sarah may take additional time in the restroom, and things like a need to pull her pants up and take them down a set number of times, like 4 times, or turn the water on and off a certain number of times, are things that are really how she is managing. And they do then take time. And so we want to be aware of not rushing her with those things. And she also has some intensity with her rituals of entering and exiting a doorway a set period of times, sitting down and standing up in a seat a set number of times, touching her shirt, touching her nose, touching the insides and outsides of her eyes, things like that, that are not things you haven't seen before, but they have really intensified. And prompting her to hurry, or, Sarah, we really need to leave this room right now. Or just come on, I need you to go through. Or they're just trying to help you with opening the door. You should just let them. Things like that are, one, going to delay the transition more because it's going to restart the ritual. And two, are going to cause some undue mental stress for Sarah that we don't want, because we really don't want to regress back to that unsafe place. So reminding ourselves that we need to be patient. Also that we don't need to interact during those times. When she was with me in the community, and we were, she was going in and out of a doorway 4 times, I just didn't interact during that time. I just stood and waited. And then as soon as she was through, we resumed what we were doing. Same when we were getting ready to leave. We were almost about to leave, and she realized that she needed to sit down and stand up more times from the booth. I realized that made it take longer, but it is not a delay to escape the next thing. She was going to a thing she preferred. There just are, the way that her brain is managing things right now, a need to go through those steps. So we want to support her in that she goes through those steps. She doesn't need anything extra during those times. We just want to let her finish it and then move forward. So we're going to not hurry, not become frustrated if she is doing something that we think seems so silly or unneeded, because we don't want to delay further. We don't want to restart the ritual, and we don't want to cause a bunch of stress. We do want to increase our level of positive reinforcement and pairing. Just pairing is, building that relationship with Sarah, really focusing on how happy we are to see her, how glad we are that she's there, things of that nature. And even if she's doing something that is expected and that she can always do it, still giving her that positive praise for doing it. Sarah, thanks so much for coming to class. Sarah, you did a great job putting your tray away. I mean, you don't have to, it isn't like we're going to put all of our attention on her. Clearly, there's lots of other participants, but weaving those things into the day, just like I know you guys already do, and do with all of the participants, will really help. If she is really perseverating or asking repeated questions about access to something, trying to not give it a uncertain time frame. So like, oh yeah, Sarah, you'll get to do it at some point. If there's any way to give her that reassurance of, oh yeah, Sarah, remember, you're going to get it the very next time we do it. We do that on Tuesdays, or I know that you didn't get to do this, but think about that you'll get to do this on Monday, or whatever it is, reinforcing for her so that she can self-reinforce, I'm going to get to do this again. This didn't go away forever. If she needs to call her mom more times during the day, we want to let her do that. She'll have her phone with her. So if she needs to step away and do that, we don't want to block that, because her mom is really her primary caregiver, most reinforcing to self-soothe. So if she needs to do a couple of calls, we want to not block access to that. And then finally, if any of you guys see an increase in non-responding, you're saying things to her and she's saying nothing, she's staring off frequently, especially when people are talking to her, those are kind of the first initial signs of reemergence within the psychosis. It doesn't mean that it's happening then, but it is something we want to be aware of, so we can check in. If you guys could call me or call mom, and then also prompt her to engage in something. If you're seeing a lot of that, like blank affect and just staring, giving her maybe a couple of choices of things that she could do that are available then, but try to get her reconnected to her current environment would be great. I have a little bulleted list that everybody can refer to from this. Obviously, I'm always available. If any of you guys want to reach out or need any support, please do that. And I'm so glad Sarah's coming back.